So what are some of our pharmacologic treatment options? Andy, I think you're doing a paper on the non-stimulants for ADHD now, if I remember correctly.
That's right. I'm working on a paper summarizing the currently available non-stimulants as well as some in development, and we'll talk about that later. But as far as currently available non-stimulants, we really only have 3 that are FDA approved. And of those, only 1 is approved for both children and adults, and that's atomoxetine. Atomoxetine is a norepinephrine reuptake inhibitor, and as I've said, is effective for children and adults. We have also 2 drugs that are considered alpha-2 agonists. They work by binding to specific norepinephrine and noradrenergic receptors. And these are extended release versions of both guanfacine, the brand name of that is Intuniv, and clonidine, the brand name there is Capvey. Both of these, as I said, are only approved for children and adolescents, but they are approved both as monotherapy or as combination with stimulants, which is where I find I get the best results, to be honest, with them for a variety of reasons. Now, there are some treatments that are used off-label, and so we have antidepressants, for instance, such as bupropion. We use SNRIs, and then the older tricyclic antidepressants, especially dizipramine, get used. Of course, there are limitations there with efficacy and tolerability. And I would say even for the 3 FDA-approved treatments, we've got issues with inadequate efficacy or inconsistent efficacy. Of course, their efficacy is not as strong as the stimulants, and there are some safety and tolerability issues. And a final group of medicines that are used are the wakefulness-promoting agents, such as modafinil or armodafinil. And again, they're not FDA approved, but there is some evidence that they can be helpful for certain patients. So they sometimes work their way into our algorithm.